Perfect. Alrighty. Well, good morning, everyone. This is the Communicable Disease and Nicotine Cessation training. We try and at least have these twice a year. I will either, based on our program and county trends, I will pick a communicable disease to share with you all along with nicotine cessation. This year or this quarter, I decided to go ahead and share with you all about hepatitis A. So if you all remember, I gave everyone a training on hepatitis C last time. And I'm actually going to be using the information from the County of San Diego. They just released this information. So I thought this would be perfect for us to kind of go over together. Let's see. Okay, so hepatitis A, and this is according to the County of San Diego Human Service Agency, and this is updated as of April 5th, 2023. They went ahead and they were able to provide this information in one of our committees with the substance use disorder programs. So I wanted to start off with just sharing an overview of what it was shared during the presentation. With hepatitis A, it's a virus that is primarily transmitted via the fecal-oral routes. So, face-to-face. Incubation period ranges between 15 to 50 days, which an average mean is 28 days that the virus can stay in your system before it's active or not active. Period of infectionness from 2 weeks before through 1 week after the onset of jaundice or elevation of liver enzymes. And the virus viable outside body for months, depending on environmental conditions. So this is a virus that can lay on surfaces and are active and can still, contaminate and pass this along to you or anybody else. There's modes of hepatitis A virus transmission, so kind of what I was mentioning earlier. Some example are person-to-person contact, transmission within households, sexual transmissions, residential institution transmission. So this is for someone who is living in a residential center, recovery center, daycare center transmissions, transmissions among military personnel, contact with contaminated food or water, consumption of raw or undercooked shellfish, vegetables, and other foods, consumption of foods contaminated by infected food handlers, also illicit drug users. Hepatitis A virus is usually transmitted via the fecal-oral route, either via person-to-person contact or consumption of contaminated food or water. So those are the two most popular ways that hepatitis A can be transferred to people. Moving on now, hepatitis A symptoms. So when someone is experiencing fever along with fatigue, nausea, loss of appetite, jaundice, right, which is the yellow coloring of skin, stomach pain, vomiting, and also dark urine, pale stool, and diarrhea. These are all symptoms of hepatitis A. So just being mindful of why it's important for, the people that we serve along with us, knowing the symptoms, because then we know when to refer our teens or our team to go get a physical exam. Okay, so who is at risk? So travelers to certain countries, obviously the cleanliness or just different countries go by different protocol in regards to facility maintenance and stuff like that, or food handling. So there's a higher exposure with those countries, so don't have the same regulations maybe in the States or in different areas. Men who have sex with men are also at high risk contacting hepatitis A. Injection and non-injection drug users, very similar to hepatitis C. When we talked about hepatitis C, we also mentioned that Injection and non-injection drug users are also a high risk for contacting hepatitis A, B, and C. And then lastly, persons with chronic liver disease. With the new information that we have, also those who are at risk are those who are homeless, those who are experiencing homelessness, or those with unstable living conditions, household members and other close personal contacts of a adopted child, and that has newly arrived from countries with high or intermediate hepatitis A occurrences. Persons with close ongoing contact with persons who are experiencing homelessness and or illicit drug users, or their environment via employment or volunteer activities during the outbreak. So this is, the last part is us, right? So we have contact with either people who are experiencing homelessness and or using illicit substances, or we are in an environment, like Annabelle, that does volunteer activities, or our employment in general serves people who might be at a higher rate exposed to hepatitis A. And it says, especially during the outbreak, and we just received notification, I believe last week, there's a hepatitis A outbreak in San Diego. I will go ahead and share that with you in a little bit, but being able to know that that those are all things that we need to be aware of when we're serving the population that we serve. When we talk about hepatitis A prevention, the spread of hepatitis A can be reduced by the following, which is adequate supplies of safe drinking water, proper disposal of sewage within communities, and personal hygiene practices such as regular hand washing before meals and after going to the bathroom. Vaccination is the most reliable protection from HAV infections and consists of 2-dose schedules. So putting this into perspective for True Life, or even for our agency, it's really important for us to have, for example, at the hub, we have water bottles, right? We also make sure that, the teens, when they use the restroom, they wash their hands, but also before they grab their snacks or their pizzas, food that we provide them before a group or after a group, that they wash their hands regularly, and it becomes a regular practice for them. So this is good information for us, to put into practice. So I kind of mentioned the 2-dose vaccine. There's 2 types. I can't pronounce the full names of those, but it sounds like one is Havrix and the other one is Vacta. And so when it comes to hepatitis A vaccines, the pediatrics recommend it for those kids that are 12 months up to 18 years of age for both vaccines. And then there's a third one, which is Twinrix, and that one's only for those who are 18 years and older. Continuing a little bit more with prevention and control measures. Once again, being mindful of our hand hygiene, no food preparation by case for others during cases infection period, dedicated bathroom for case when possible during cases infections period, exclusion from sensitive occupations or situations, post-exposure prophylaxis, which is called PEP, for all those close contacts, shared bathroom, prepared food for, spent the night, sexual contact. So this is more of a control measure for anyone who has been around or is living with someone with hepatitis A. These are kind of the steps that would be taken. Infection control. So if we know that there is, hepatitis A going around in our community, We want to make sure, and even then, just being mindful to wash our hands with soap and running water for at least 20 seconds after providing care for an HAV patient. Use contact precautions in addition to standard precautions in the care of diapered or incontinent HAV patients. Wash hands with soap and running water for at least 20 seconds before eating and after using a restroom. Use employee designated restrooms when available and do not touch the door handle directly when exiting a restroom. So I know within the hub, we have a employee designated restroom as well as Vista Main. And I know that with the townsite building, we also have restrooms for our staff. But we do know that, sometimes community members during meetings and stuff like that will use them. Alrighty, so hepatitis A infection control. So what is recommended from the county is to disinfect surfaces that people touch a lot. So that includes all bathroom surfaces, all kitchen surfaces, anything else that people touch a lot. So you can see right there visually the bathroom, kitchen, and then forks, light switches, ACs, right? Trash cans. Those are all things that need to be disinfected. They do recommend for us just to use bleach and water. That is the best way to kill hepatitis A. So I know that we have, as a agency, cleaning products, right? But it does say that most cleaning products don't kill Hep A. So it's very interesting, and I just wanted to share this information, and I can share this along with everybody else, including Dave, that kills Hep A. Always mix bleach with water. I know that there's an odor piece that comes to it, but um, also just being able to check all our different products that we do use, and to see if they do kill Hep A. It's really important for us to read the labels. Anything that says effective against Hep A or effective against feline calicivirus would suffice. So once again, putting this into perspective, this is why it's really important that when we hold food groups for our kids, when we do assessment with our youth, and they use the tables, countertops, utensils, that we wash them really well, and then we sanitize every space that is being used. Okay. So it also even provides us with how to use bleach to disinfect for hepatitis A. So one, you want to protect yourself from the bleach. You wear gloves and a mask. Two, get air flowing, so open windows or use a fan. Clean surfaces, use soapy water. Disinfect surfaces, and then it says, measurements based on the amount of water you want to be using. And then it does ask for us to let it sit. You apply bleach, you leave it for 1 to 2 minutes, and then you rinse with water, dry with paper towel or air dry. Once again, it says don't save your bleach and water mix. It stops working after 24 hours. And that's a very interesting fact that I did not know. So we're going to go a little bit into hepatitis A data. So nationally, as you can see, in 2010, it was lower cases, and as of 2017 and moving forward, the hepatitis A incidence continue to increase. These are the number reported cases that we have had in the United States. Since the outbreaks were first identified in 2016, 37 states have publicly reported the following as of March 3rd, 2023. Once again, this is beginning of the month. There was 44,797 cases. there was 27,354 hospitalizations, and there was 421 deaths. Locally, as you can see here, that through the years, they've been implementing vaccinations where in 1995 vaccines were introduced, so that lowered the numbers. And in 1999, there was routine vaccination for children in high incidence states, including California, which dropped it down, as you can see. And then there was also another routine vaccination for all US children. And as you can see, the numbers like right across the board in 2017, they took a big peak. So it's really important for us to stay consistent with, guidance from the County of San Diego and keep an eye out when, breakout notifications are happening. I know that we have a mailing subscription from the county. So any high risk outbreaks or cases will be shared with either myself or even Dawn has forwarded a couple of those emails to the program leads. So making sure that we provide this information to our teams. So from 2016 to 2018, there was an outbreak here. There was 592 confirmed or probable outbreak cases. From November 2016 to July 2008, there was 414 hospitalizations and 20 deaths. 404 of those were males and 188 were female. And the ages ranged between 5 to 87. The average was about 44, 43-year-olds. Suspected exposure type is out of all those people, what categories did they fit into? 34% were experiencing homelessness and using illicit substances. 15% were only experiencing homelessness. 13% were only experiencing illicit drug use. And then there was 28% who were neither, didn't fall any of those brackets. So they were suspected exposures and not found upon review. And then there's that small 9% that were unknown. Now looking at hepatitis A this year, these are the local case counts. So as of this year, there's been 16 confirmed cases active for Hep A. All are PCR, plus for hepatitis A virus. Out of those 16 folks, 3 of those were, people experiencing homelessness. 7 of those were persons experiencing homelessness and using substances. 1 was only using substances. 2 was because of international travels. And then there's the other 2 that were, there was no known risk factors. This resulted in 11 hospitalizations and 1 death. So as you can see, 2023, things are looking a lot different. We're able to, I thought it was very interesting. We're able to travel now and, services are now even much more open. The county wants us to provide more face-to-face services, meet our clients where they are at. But we have to be mindful of these things when we go out to the field, when we provide services to our population. And just so you know, during certain subcommittees, they provide local case counts for the most the communicable disease that's most present. So I know that for a really long time we would do weekly, bi-weekly COVID case counts, but just recently, because of hepatitis A outbreak, as of May 6th, I believe, they've been reporting hepatitis A case counts. And we have the local hepatitis A webpage. So if you go to the San Diego County.gov Hep A, they're able to have like these posters, these are, you're welcome to print these out and put those up at the restrooms and Vista Main, or even in the hub bathrooms as well. We can definitely talk about that. There's a lot of wealthy information in regards to transmission, symptoms, prevention, and resources. If you go to the website, it'll also provide you the case counts per week and also vaccine summaries. The page is refreshed every Wednesday. You will also be able to get information on where you can get vaccines and the guidelines to vaccines. Also, there's, a letter archive. So the newsletters that come out are stored in that webpage, along with communication tools, like I mentioned, posters, flyers, fact sheets, and etc. Alrighty, and that was the first portion for hepatitis A. And let me...
Marissa, can I ask a question?
Yes.
You mentioned that you and programs will get notifications. Sometimes Dawn forwards those notifications. Well, I'm wondering if there's any way that we, folks that are not part of the program, the program team, we're not running programs. I don't think I've ever gotten a notification. Is there any way that maybe you can forward those to some of us that don't get those emails?
Absolutely. So I did pull up the one that I just recently got this week. This one was, or last week, this one Dawn sent out to some of the program managers. But I'll make sure that this information gets sent out. And it did say, dear behavioral health services provider. So there is a specific pool. Maybe that's why they're reaching out to the specific program. But it says, sorry. Dear behavioral health provider, a health alert was issued May 16th regarding an increase in hepatitis A cases among the San Diego County residents associated with homelessness and drug use. There is the California Health Alert Network. This is where everyone can link to and put their email in to get weekly or monthly alerts. But key points include, 28 cases of acute hepatitis A virus, HIV, infections have been confirmed in San Diego County residents since the beginning of 2023. The majority were among people experiencing homelessness and people who use drugs. Early identification of cases, post-exposure, prophylaxis, and vaccinations of at-risk populations are the key ways to prevent hepatitis A. Vaccination of PEH is recommended in settings such as emergency departments, federally qualified health centers, and any acute care settings. And then report all suspected and confirmed HIV cases to their confidential reporting system. And they have a number there that's displayed. And it says, please ensure your clients who are not up to date with their hepatitis A vaccination are offered these preventative measures. This is especially important in PEH and people who use drugs. If clients have health insurance, including Medi-Cal, they can be referred to hepatitis A vaccination to their primary care doctor. If clients are uninsured, you can refer them to the nearest county public health center. And once again, it says to directly receive all future San Diego cans that are released, please subscribe with the link if you have not done so in the past.
Okay, that's good to know. So maybe if you can just forward that email, and then those of us that are not in the email and are interested in it, we can just sign up ourselves, sign up our emails.
Absolutely. So after this presentation, I'll ask Josue to send the acknowledgement form that you participated on the first half of this training, along with the link for subscription.
Thank you.
No problem. All righty. So then we're going to jump into the second half, which is the smoking cessation and behavioral health. I wanted to give everyone a heads up that this presentation is very similar to the last one we received. I didn't want to tweak too much of it because it's all very current and it's all very helpful information for us. So it might be a little refresher for everybody. So I just wanted to put that out there. So let's start with an overview. We're going to do the vocabulary review, prevalence, mental health implications, and products, and then resources. So vocabulary when it comes to nicotine cessation, tobacco, and the tobacco smoke contains thousands of chemicals. It is a mix of chemicals, not nicotine, that causes serious disease and deaths. So tobacco and nicotine are different. Nicotine is the highly addictive chemical compound that is present in the tobacco plant. And then another term that you will see is ENDS, which stands for the electronic nicotine delivery systems, which is e-cigarettes and e-liquids. And RT is another term you will hear about, which is a nicotine replacement therapy. And prevalence among youth, flavored ends products are extremely popular among youth, with over 80% of e-cigarette users being ages between 12 and 17. As of last year, the FDA is still reviewing about 6.5 million new tobacco products, many of which are ends. The impact among youth is still undergoing investigation. So I know that we've heard about popcorn lung and all these other side effects, right? That we're still trying to figure out, if they're coming from these ends products. Relation to mental health. So two health crises among youth, a mental health crisis and a vaping epidemic is current. And it poses, increasing threats to a new generation of young people. So current e-cigarettes users have double the odds of having a diagnosis of depression compared to those who have never vaped in their lives. Frequent vaping is tied to even higher odds, 2.4 times, of having a diagnosis of depression compared to never users. Nicotine harms developing brains, including making young people more susceptible to addiction and ongoing withdrawal cycles. Vaping has significant association with higher levels of ADHD symptoms based on 2019 study of college students. Using e-cigarettes as an adult also had nearly twice the odds of association with cognitive complaints. So people will also know them as depression sticks. And these are some of the nicotine products that we see. I mean, obviously now they're more trendy and are more, you're able to hide them more often. But these are the vapes, pens, mods, pouches, and then we have pods and then cigalikes. And all of these can contain nicotine and sometimes are mixed with THC. Tobacco and nicotine products, like I mentioned, there's a couple of them like cigarettes, cigars, and chewing tobacco. NRT, which is nicotine replacement therapy. Teenagers have to get a prescription because NRTs have been approved by the FDA for use in children. I'm sorry, NRTs haven't been approved by the FDA for use in children. Instead, they're considered an off-label medication for anyone under 18. So we have a good resource within Vista Community Clinic that is able to provide NRTs. We always refer, right, if any of our teenagers want to get resources and get more information. And the same thing with anybody else that's part of the program or is interested. We have a good connection with Vista Community Clinic, who is able to provide educational presentations along with treatment. Our teams do have resources, so they do provide individual telephone counseling. They will receive one quick call, and they receive up to 4 relapse prevention calls. They also will be able to obtain self-help materials. Someone can text "quit now" or "quit vaping" to 66819 or enroll in nobutts.org. There's also an online chat through that website that they can use. And then they have made it, more accessible to teenagers by having, smartphone apps to access their support. And then Alexa skill for quit smoking tips, stop smoking coach. Resources also available. So it's a trifold and it gives you information on how to quit substances. I'm sorry, quit nicotine. And then the helpline breakdown. So, as a reminder, these are the steps that usually happen when a teen is referred or an adult is referred to the helpline. So they will receive a 7-minute intake call, and it really determines their need. So they will ask frequency of use and frequency of maybe even withdrawal that they experience. Initial session is comprehensive, so it's about 30-minute call, and they talk about the preparation that needs to happen to quit and also setting up a quit date. And then they have follow-up. Like I mentioned, they would take about 4 of those, and they take about 8 minutes per call. They do a lot of relapse prevention and then pharmacotherapy review. So this is normally how a teen or an adult would receive services. There is available trainings and websites that will help, for example, our clients, the teens.smokefree.gov works as a one-stop shop for the clients and those assessing them. And then for staff, nobuts.org provides free training, free materials, and provides information on quit lines. And then, of course, for our program for True Life, we have the lung training, not on tobacco curriculum to better support our clients. So the teens who come in through our doors who are identifying that they're smoking or vaping, we will not only provide them resources in that moment, but we will also enroll them in nicotine cessation classes to make sure that they have the education and the resources to make healthy choices. And then I wanted to add these slides, its impact on youth, the now and later. I wanted to share some interesting information that 3 out of 4 teens who smoke cigarettes in high school will still be smoking as adults. So that's a high number of kids that, age and still continue to have the smoking habits. Symptoms of nicotine withdrawal after you stop using tobacco are craving cigarettes, feeling sad, irritable, or having trouble sleeping are some common symptoms of withdrawal. These symptoms are usually the strongest in the first week after quitting, but they are only temporary. So sometimes we have teenagers who are experiencing withdrawal from marijuana and nicotine. So I wanted to share that, those symptoms for nicotine are very similar to other substances that our teens come in with. And using nicotine at your age can also rewire your brain to become more easily addicted to other drugs. So the way that nicotine impacts our brains, right, it is rewiring and causing and opening doors for higher addictions. And nicotine can have other long-lasting effects on our brain development, making it harder for folks to concentrate, to learn, and to control impulses. So part of our program as well is we go out to the schools, letting our teens know that, their brains don't stop developing, plus 21 or older than 21. So it's really important for our teens to make sure that they understand how it affects their brain development and impacts their schooling and making healthy choices. And also I wanted to share, because I know that sometimes we get this with the youth that we see, but there's no such thing as a safe or safer tobacco product. If we think about it, cigarettes typically consist of tobacco, chemical additives, a filter, and a paper wrapping. The smoke inhaled from a burning cigarette contains a mix over 7,000 harmful chemicals. Smokeless tobacco is tobacco that is not burned. So there are many types of smokeless tobacco, including chewing tobacco, oral tobacco, spit or spitting tobacco, dip, chew, and snuff. Smokeless tobacco has high levels of chemicals and other substances that can cause cancer. People who use smokeless tobacco have a high risk of mouth and throat cancer. Hookah, which is hookah water pipes, smoking has many of the same health risks as cigarette smoking. The smoke from a hookah has high levels of carbon monoxide and chemicals that can cause lung, bladder, and mouth cancer. And then we have e-cigarettes are also called e-cigs, vape pens, mods, and pod mods, which often look like USB drives. And I showed a picture earlier. And these devices heat a liquid into an aerosol that's inhaled by the user. The aerosol from the e-cigarette is not just harmless water vapor. It contains a mix of potentially harmful chemicals that are not safe to breathe. So once again, I know sometimes we do hear that, you know, hookahs, e-cigarettes are safer than, cigarettes themselves or smokeless tobacco, but in fact, it is not. None of them are safe. And that was it. That was my presentation for everybody. We just went through hepatitis A, and then we went through nicotine PowerPoint. Um, I will go ahead, like I mentioned, forward that information to everyone so everyone stays current with updated notification from the county of what outbreaks are happening and what resources are available to our community. If you have any questions about certain communicable diseases as you hear about them, feel free to reach out to me. I am the program's communicable disease liaison. So part of my role within the program is to make sure that I'm up to date with communicable diseases, or if there's something that's present that I look into it, provide resources for our teams and for our program, along with nicotine cessation, providing resources in regards to nicotine, or if you have any questions about those products, that you can reach out to me and I can refer you to the appropriate links and resources. Does anybody have any questions? Okay, I think that's a no.